Welcome to the video training program of InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We're excited to show you everything InTouch EMR can do to streamline your practice. So let's get started.
Hi everybody, this is Nitin Choda, CEO of InTouchEMR.com and InTouchBillerPro.com, and in this video training we're going to address how Obamacare, or the Affordable Health Care Act, is attempting to tackle the problem of overutilization. Now, overutilization is essentially more about preventing the utilization of expensive services as opposed to reducing the cost of those services. Now, Obamacare is not only attempting to reduce the cost of services by paying out less to medical providers and to medical professionals, but Obamacare is also attempting to actually make patients more responsible for their health care. It's changing the way patients perceive health care by making them more financially responsible, and it's also making sure that patients don't try and seek services that they shouldn't necessarily need, and it's encouraging medical professionals, which includes physicians, physical therapists, speech therapists, mental professionals, to approach medicine the same way. Now, here's what's actually happening. One of the key advisors to the president, his name is Dr. Ezekiel Emanuel. His opinions played an important role in the development of Obamacare. He's one of the key advisors to the president. He advocated reducing healthcare costs through a combination of methods that include scaling back on luxury items, scaling back on expensive tests, scaling back on fancy hospital rooms, nice waiting rooms, scaling back on all that and going back to the basics as an attempt to tackle overutilization. Now, the Obamacare, the Affordable Health Care Act, has actually made a basic assumption that both patients as well as providers seem to overindulge in healthcare. In fact, the assumption is that a lot of patients are asking for services, asking for treatments that aren't really necessary. That's one of the assumptions in the Affordable Health Care Act. So, like I said, expensive hospital rooms, convenient parking, facilities that are designed for comfort rather than utility. Obamacare is attempting to tackle all of that. So, Obamacare essentially is an attempt to get clinicians to prescribe only the tests that are absolutely essential. Obamacare cites drug costs that are 10 to 30% higher, sometimes even more than that, 10 to 30% higher than the cost for the same drug in other parts of the world. So all of this is essentially the justification for Obamacare and its attempt to tackle overutilization. Now, Obamacare actually includes a very multifaceted approach to reducing overutilization. Medical facilities and practitioners that produce results quickly are going to be rewarded financially. So instead of the fee-for-service model, we're looking more of an outcome. As a clinician, you should be thinking more in terms of an outcome-based approach. You need to be able to demonstrate that your outcomes are superior and you get patients better faster. That is the direction in which things are heading. The goal is for clinicians and patients to use fewer unnecessary tests and spend less time so that the cost of healthcare is reduced. So the idea is to use a patient's health history to be able to determine what's wrong with them and fix them faster as opposed to treating them over an indefinite period of time. So essentially the cost of the technology of the underlying service remains the same, but the idea is to reduce the utilization of those services. That's really how Obamacare is attempting to solve the problem of overutilization. Like I mentioned, individuals and consumers now have more responsibility. They're tasked with basically improving their health and using more preventive measures, and employers and insurers are using financial incentives to promote healthy lifestyles and encourage people to stop activities like smoking, drinking that are potentially unhealthy. So all of these things are an attempt by Obamacare to, on one hand, reduce overutilization, on the other hand, focus more on prevention. It's important for you to know this as a private practice owner, because you should be focusing on two things. A, focus on outcomes, get a patient better as quickly as possible and prove it using different types of tools. We have sophisticated tools for outcome measurements built into intouchemr.com. And on the other hand, as and when Medicare defines its policies on wellness and prevention, start to offer more wellness and prevention services if it's within your scope of practice. Thank you so much for watching, and I hope this video was beneficial and you had some insight on how Obamacare is attempting to tackle the problem of overutilization. Thank you.
Thanks for watching this video training from InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We'll see you in the next training module.